Dear students, welcome back. In the previous session, we have discussed developmental aspects of structure and function and also changes in normal structure and function of the thorax. So, in changes in normal structure and function, we have discussed scoliosis, isn't it? The musculoskeletal changes. So the musculoskeletal changes, that means there is a lateral deviation of the vertebral column on the posterior aspect leads to the restrictive lung diseases. So that means it decreases the functional capacity of the lungs, isn't it? So if any changes in the pulmonary, that means any changes in the lungs, also having some effect on the biomechanics of the thoracic cage. So changes in the pulmonary system also alters the thoracic cage biomechanics. Okay, now we will see that kind of thing in pathological changes in structure and function. Pathological changes in structure and function. These are the changes in the pulmonary system which will affect the biomechanics of the thorax. So, now we are going to take a condition called as, it's not a condition, it is a group of diseases combined to called as obstructive pulmonary diseases, that is COPD. COPD is nothing but chronic obstructive pulmonary diseases. So the name itself indicating that there is some disease related to the pulmonary system. It may be the bronchus, it may be the trachea, it may be the bronchi, and then the bronchioles or even the lung tissue. The disease may be any of these things. Any of this thing is or going to be affected in this chronic obstructive pulmonary disease. The major manifestation of this COPD is damage to the airways. One is the damage to the airways and the destruction of the alveolar cells, destruction of the alveolar walls. Okay, this is the common manifestation of the COPD. Okay, now commonly the COPD includes 4 pulmonary diseases. One is chronic bronchitis, second one is emphysema, next one is the bronchial asthma and the bronchiectasis. All 4 are called as obstructive pulmonary diseases. But the first two, the chronic bronchitis and emphysema, these two are commonly seen chronic obstructive pulmonary diseases. Normally, these two diseases may occur singly or both clinical features combine to give another kind of syndrome. Okay. So normally the first two, chronic bronchitis and emphysema, cause it due to cigarette smoking. Okay, that cigarette smoking, the chemical which is present in the smoking, which causes damage to the airways as well as the lung tissue, leads to the obstructive pulmonary diseases. Okay. So once the tissue destruction occurs with disease, so if all this tissue are going to destruct with this disease, what will happen? So normally the lung will have the elastic recoil property, isn't it? So during inhalation and exhalation, this will expand and then relaxed. Okay, so in such kind of property is going to lost. So once the tissue destruction occurs with disease, the elastic recoil property of the lung tissue is decreased or finally it is diminished. So if the recoiling property is not exhibited by the lung tissue, how exhalation is going to occur? As we know that during quiet breathing, exhalation occurs through the elastic recoiling of the lung, isn't it? Elastic recoiling of the lung. But in such cases, it does not occur properly. In such cases, does not occur properly. So the passive exhalation is dependent on this elastic recoil property. So the patients who have COPD, exhalation become ineffective. Exhalation become ineffective. That means what happened? So once the exhalation is ineffective, that means removing an adequate amount of air from the thorax is not occur. So then what happened? Air remains in the lungs. Air remains in the lungs. That means air is trapped. Air is trapped inside the lungs. So once air is trapped inside the lungs, what happens to the size of the lung? The size of the lung will increase. Once the size of the lung is increased, such state of lungs are called as hyperinflated lungs. What do you call? Hyperinflated lungs. That means air which is present inside the lung is beyond its normal limits. Then it is called as hyperinflated. Okay, now again we will see. So in COPD, the major manifestation is damage to the airways or destruction to the alveolar walls. Once the tissue destruction occurs with this disease, the elastic recoil property of the lung tissue diminished, which leads to passive exhalation ineffective. Finally, because of this ineffectiveness of exhalation, air gets trapped, that is called as air trapping, which leads to hyperinflation. So what happened if what happens if the lung is hyperinflated? అయితే ఏంటి? What happened? సో కావాల్సిన దానికంటే ఎక్కువ ఉంది కదా. So what happens now? What are the effects caused by this hyperinflation? So this hyperinflation causes changes. Again, this hyperinflation causes changes in the biomechanics of the thorax. Changes in the biomechanics of the thorax. So what happens? So here you can see this is the diaphragm. We can see here the dome of the diaphragm here, isn't it? So diaphragm we can see here. Yes. So what is the function of diaphragm? Mainly the diaphragm helps in inspiration, isn't it? Once air is inspired, then what is happen? What this diaphragm, the dome of the diaphragm decreases, so it will move downwards, isn't it? That means it becomes flattened. So once it becomes flattened, the intrathoracic pressure decreases and a negative pressure inside the lungs increases, which sucks the air into the lungs, isn't it? So already these lungs are hyperinflated. Then what happens? So this becomes flattened. So the diaphragm becomes flattened. Once the diaphragm becomes flattened, again inspiration occurs. The work of the diaphragm is affected or it is in normal. So already it is in hyperinflated state. The lungs are in hyperinflated state. The dome already it is decreased. Then there is no further decrease of the diaphragm will takes place in the next inspiration. So finally the function of the diaphragm here is compromised during hyperinflation. Okay, so the resting position of the thorax, normally the resting position of the thorax is a balance between the elastic recoil properties of the lung pulling inward. So once it is expanded during inhalation, it has to come back to its normal thing, isn't it? So it has to pull back. So with that thing, what will happen? Once it is pulled back, the diaphragm will come up, isn't it? Once this diaphragm comes upward, the zone of opposition here, the zone of opposition increases. So then these fibers, already it is in bucket handle movement, so they are pulled back again. They are pulled back again to its normal position. Normally the lower rib cage is in outward. Okay, so normally it is present in outward like this. So the thorax is present like this, isn't it? So this is already it is in outward position. Okay, in bucket handle movement it moves upward and laterally. Upward and laterally. Still the outward angle of the thorax is maintained during inspiration as well as in expiration. Okay, because of the balance between the elastic recoiling properties of the lungs pulling inward and also the normal outward spring of the rib cage. So with this balance, the resting position of the thorax is maintained. The resting position of the thorax is maintained during ventilation. So due to hyperinflation, all these two factors are going to be affected. What happens? In COPD, there is an imbalance between these two opposing forces, as I have explained earlier to this point, which alters both lung volumes as well as the lung ventilatory capacities. So these imbalance in these two opposing forces affects both lung volumes as well as the ventilatory capacities. So lung volumes already we have seen in the earlier video. What are the normal lung volumes and the ventilatory capacities? Okay, so that thing I will explain in the next video about this lung volumes in COPD. Okay, so first you just know that because of this imbalance which occurs due to hyperinflation in COPD patients affects both lung volumes and ventilatory capacities. Okay, so as the elasticity decreases, so what happens? More air is left inside the lung. That is called trapping occurs. So what happens? An increase in the AP diameter occurs. An increase in the antero-posterior diameter of the hyperinflated thorax increases. Okay, so along with the flattened diaphragm, There is an increase in AP diameter of the hyperinflated thorax takes place. So which leads to barrel chest in the upper rib cage, which leads to barrel chest in the upper rib cage. The chest appears like barrel shape. So now it is having a truncated shape, isn't it? It is having a truncated shape, but it leads to barrel shape. So it leads to barrel shaped chest like this. Barrel shaped chest. This kind of chest appeared in the anterior view. Okay, if you see on the lateral view, so the anterior convexity we can see in the lateral view in the case of barrel chest. Okay, so these are the things happened in the COPD due to hyperinflation. So then what happens? So here the diaphragm is not up to the mark. Then what happens? The range of motion of the thorax is limited in obstructive pulmonary diseases. So what is the basic characteristics of COPD? So the basic characteristic of COPD is an inability to exhale sufficiently. So as a result, the inspiratory capacity is compromised. What happens? The inspiratory capacity is compromised. Okay, this is about what happens in COPD. In the next video, we will see what happens to the bony chest wall, what is the actual thing happened to the diaphragm, how this hyperinflation decreases the work of the diaphragm. We will see in the next session. Thank you.